This is what Susan spoke of earlier. It's called Echo. Just happens to be their stethoscope, but you can actually buy the piece and put it in a Littman or any other stethoscope of your choice. But basically what happens is you take something similar here as an iPod, you place the software on here, the app, and then this connects to it via Bluetooth. As you can see, the green light on it here is lit up, means it is connected. So as we wait for them to get ready, as we get ready for them, one of the things that we do is once our patient's diagnosis has been determined, then the physician in the ER will determine, does this patient need a cardiac consult here and now? And so that's what we do.
We were able to bring their staff on here October the 1st, and we began orientation. They've done EPIC training, they've learned processes, our care settings, all while they were waiting on this location in McKenzie to open. Also during this waiting period, we have been able to take care of some patients from McKenzie who have made the short drive over here and have their hometown care team take care of them. So they have come here just because they want those same people that they've always had treat them take care of them. So that's been great. The athletic trainer has been able to continue to cover football games for McKenzie, home basketball games, and home soccer games, and has maintained his relationships in the community with the coaches, athletes, and their families. We're also excited that the new clinic will be able to continue the wellness program they had for their community members there in their physical therapy clinic. I'm happy to say that as of this week, we actually passed the state inspection, so we are going to begin seeing patients there Monday morning. And we already have several patients that started with us here in Huntingdon that are going to make the drive back to McKenzie and continue their therapy there close to home. So we feel we have just a great opportunity to bring high quality therapy services not only to Huntingdon and to McKenzie, but to all parts of our county and also to the surrounding communities. So that's kind of our story.
We have 242 ICU beds that we monitor. So we have the nurses sitting in the corporate office at Memphis, and they're just available at the touch of a button. So we install these buttons on the wall as well. So when the ICU nurse here needs some assistance, she can call from the phone, or she can just come to the wall and hit the button, and the ICU nurse will come on the screen. And then when they need the physician at night, then they can tell the nurse that they need the physician, and within seconds the physician comes on.
Hey, Alex.
Good morning.
So
hello.
This is Alex Matthews. She's one of the nurses in the EICU at the corporate office.
Good morning.
Alex, you want to give them a little rundown of what you do every day?
Okay. So we are a second set of eyes for our bedside nurses. We help support them in any way that we can. We have full access to their charts through Epic. We can look at their lab work, chest x-rays, any CT scans, anything that they're doing at the bedside or taking for procedures. We can keep an eye on from our end and make sure that the treatments are appropriate. We look at antibiotics for any of our septic patients. We have a sepsis protocol as well, like they do at the bedside, and we follow it and make sure that everything is going the way it should be so that the patient can get out of the hospital as quickly as possible.
We'll be supporting after hours at McKenzie on Monday through Saturday from 5 o'clock in the afternoon to 10 o'clock p.m. Monday through Saturday, and from 1 to 6 on Sunday. The providers there will be working with the providers that are currently part of McKenzie Medical Center to make this operational. And we're really excited about having the opportunity to be there when people need it most, and that's after hours when it's hard to find somebody to help you. The second initiative, and this is where Dr. Lund and Lori Grimes and Catherine Bullock come in. We're going to be opening up an OBGYN service out of the Women's Health Center out of McKenzie, out of Martin. This will be our third operation. We have one already in Martin and in Union City, and this will be the third clinic that we have. We're really excited about that. Dr. Lund and her group have just been great supports, and I want to say hi to Dr. Lund and let y'all meet her. And Lori Grimes there. I think most of you already know Catherine. Turns out that Dr. Lund helped your child, isn't that right?
She delivered my son.
I learned that just today, so that's great. The services they do are just amazing. In that particular, just to kind of give you a flavor, right now out of our OBGYN service at Women's Health Center at Martin, we have 4 nurse practitioners, 2 doctors, soon to be 3 midwives, and recruiting for another physician or 2. And we also have Lori, who's our surgical tech, helps Dr. Lund every day, all day. And we're just really thrilled to have them. You've heard a lot about Epic today, or you heard some things about Epic. Our platform is going to be Epic as well, MyChart. If you are a patient within the Baptist system and haven't signed up for MyChart, I'm going to encourage you to do so, because as you heard from Susan very personally, how that helped her, how it helped all the providers see what was happening with her care, and you saw how fast she was able to get her care due to that. I encourage everyone, if you're a patient in Baptist and you haven't signed up, please do so. It will help you immensely. They're not here today. I don't see anybody here today, but this could not happen without the support of McKenzie Medical Center's leadership as well. And I just want to recognize them because they're not here. And I think, and their administrative team, including Jill Mayo, are very important to helping us do all this. I just wanted to mention that today, and thank you for listening to us. We really, really, really are excited about helping Carroll County.
This is amazing. And then, so Mayor, the other piece is that I think you're going to have people that want to come live in Carroll County. I live in Birmingham, Alabama. I sent my wife a text while ago and said, hey, get the kid ready. We're moving to Carroll County. With all this information, I mean, I'm a stroke patient and I just had a kidney transplant. So I was like, this is a great place to be, right? So it's impressive, really. And so really neat. So in 2015 and 16, we started talking with Baptist Memorial Healthcare to not become a vendor, but become a partner. And in 2017, and actually in April of 2017, we started that partnership in Memphis, Tennessee. And we now run over 18,000 transports a day in Memphis, or a year, excuse me, and have over 20 ambulances there in Memphis. Between April, May, and then in September, we onboarded a little over 250 employees throughout the areas of Tennessee and Mississippi with our partnership through Baptist. One of those partnerships happened in Children's Hospital. And as you see out front, we brought our children's truck up here. It will come up here if in the case we do need it. It travels throughout Tennessee, Mississippi, and Arkansas. And then in September, we were honored and privileged to onboard the staff here at Baptist Carroll County. We brought on 22 staff members during that piece, which is the same amount in October of 2018 that we joined our group with McKenzie Ambulance Service and Justin Cook, who's our Director of Operations, who's here today. And we're excited about that. We have operation substations currently in Mooresville, Huntingdon. We have our operation in McKenzie, and then we're working with Mayor Keaton to get a place there in Brewston. We think it's very important, and so we're working there to get that completed. We run over 4,700 patients a year here. So how does the telemedicine work with ambulance? Well, let me tell you what it does for the citizens of Carroll County. In the past, we've had to take patients that are stroke, STEMI, to Jackson, to Memphis, to Vanderbilt, to St. Thomas, and take our resources out of this county, which limits what can respond to patients who are in need. Well, now, because of what we have with telemedicine, we can keep our resources here in this county. That's huge. And if they need to be moved out, we'll move them out either by ground or by air. And so it is a huge, huge piece. And so thank you, Susan, for allowing us to be a part of this. Your group for planning this. I had a little idea of what happens in telemedicine, had no idea. This is amazing. And then lastly, I also want to say happy birthday to Susan. It's a So 2018, our partnership was awarded a prestigious AMBI Award by the American Ambulance Association. This county had a lot to do with that, and you can read about that on our website and also Baptist's website. We've got a lot of we brought a lot of technology to this area, and so one of the pieces is transmitting the EKGs to the EDs before, actually sometimes before the patient gets there, so the doctor there in the ER can see what's going on with this patient. So Justin's gonna come up, and I think Ricky's come up. Okay, so there it
Yeah,
is.
so-
You tell about it.
Yeah, so as a matter of fact, another one just come through right then. We got wireless internet on all of our ambulances in Carroll County. So we could be sitting, in McKenzie, over here in Huntingdon, McLemoresville, Brewston, and pick up a patient having chest pain. And, we're just able to get their care started faster. By starting the care faster, we're able to do a 12-lead EKG in the field. This 12-lead EKG, it can go to an email, it can go to a fax machine in the ER. From that fax machine in the ER, the physician in the ER can pick this 12-lead up. They can review it. If they think that we need to give a certain kind of medication before we get to the ER, then he can call back to the ambulance crew and say, hey, we need this medication started, bring them in, and then their care is just started faster. So, we're really excited about being able to have this service to the citizens in Carroll County. It means leaps and bounds for people. And matter of fact, this is one of our employees, 12 lead right here, who had MI, back a couple of years ago and everything. And so it was kind of near and dear to his heart to be able to say, hey, I'll volunteer. You can hook me up for 12 lead day. So this 12 lead right here come from right outside front here. He hooked him up in the ambulance right out front here, and then we transmitted the 12 lead into Miss Susan's email here. And not only did it go to her email, but it goes to her email, my email, the director of the ER's email, and it goes to the fax machine up here at the ER as well. So you got multiple people being involved on seeing the care of these patients and making sure it's going through to the right people it needs to go to. Not only is it an important piece to the patient's care, but it goes along with what they're working on the chest pain accreditation right now as well. It's an important piece where they can pull analytics through the various stages that they're going to be going through that process. So we're blessed to have great partners and family like Susan and them here at Baptist Carroll County. We're blessed to be able to merge everything together and get everything working together for one service for Carroll County, because it really does help having one service in the county. And it means a lot for me, just from a family perspective and everything, growing up here and growing up in emergency services. And it's been a long time coming to be able to merge something like this together, and it means a lot. So we appreciate having y'all and y'all having us. So
We love y'all.
all right, thank you.